Hello. To all of our signing members of the Get the Medications Right Institute, I'd like to welcome you to our member briefing. This is Katie Capps, Executive Director and co-founder of the Institute, here today with an update for activities over the past month, as well as some of the upcoming activities for the month of June. I hope everyone is staying safe and healthy. As we slowly begin the process of reopening, the GTMRX Institute staff is working remotely until we are allowed to return to our offices. We're still committed to moving forward and have been amplifying our efforts using phone, internet, and video technologies to hold meetings, educational sessions, and to host work group meetings. As part of our continuing efforts, our work groups, subgroups, and task forces have continued meeting regularly to support our work with every other week meetings. The GTMRX HIT and AI to support optimized medication use work group welcomes new co-leader Tom Wilson from Tabla Rasa Healthcare, a GTMRX executive member. The group has also recruited several new members, including representatives from Orange Regional Medical Center, Wolters Kluwer, Genoa Healthcare, Biopharma Advisors, Trinity Health Mid-Atlantic, and the American College of Clinical Pharmacy. New GTMRX subgroups have also been created to develop best practices and evidence-based resources in support of CMM. These new subgroups fall under the Practice and Care Delivery Transformation Work Group, which is restructured to focus on development of tools that can be used today in the market for advocacy, education, and awareness. And as they continue their work, I suggest that you look forward to use cases, evidence documents, and tools to ensure fidelity of CMM practice. I want to thank the current executive leadership of the Practice and Care Delivery Transformation Work Group, Anthony Moriali from the VA, Marcia Buck from ACCP, and Casey Thompson from ASHP. And I'd also like to thank the leaders of the two subgroups that make up the Best Practices and Innovative Solutions Group and the Evidence-Based Resources Group. I'll tell you more about their work on upcoming briefings. But if you'd like to get involved with a work group of the Institute, and you see them all outlined on this slide, please visit our website under the GTMRX Workgroup tab to learn more, or contact Operations Manager Izzy Sergey. We also continue with the launch of our GTMRX Learning Network to provide informative webinars for our membership. On May the 28th, we held a webinar with Jared Augustine of Manatt, Phelps, and Phillips, and Melissa Badowski from the College of Pharmacy at the University of Illinois, Chicago. They discussed the opportunity for expanding access to care through telehealth during the pandemic, and they also outlined some of the opportunities and barriers associated with telehealth and comprehensive medication management. If you missed this webinar, be sure to watch for communications about the webinar recording, which will be available for viewing on our website soon. There will also be a companion issue brief published in June offering more insight on telehealth during COVID-19 and opportunities to expand access to comprehensive medication management. Our June webinar will be hosting Colleen Keenan and Emily Sakali. We'll be discussing what you need to know during COVID-19 and lessons learned from implementation in team-based care of pharmacogenomics testing. Colleen Keenan is of the advisory board. Emily Sakali is from the University of Florida. They've both recently published articles on the topics. Be sure to register for the webinar if you've not already. You can go to our website at www.gtmr.org. In addition to our other events, the Institute has also launched Season 2 of our monthly podcast series called Voices of Change. Voices of Change is hosted on Healthcare Now Radio. In Season 2 episodes, I've had the opportunity to have delightful conversations with Dr. Anand Parekh, who's the Chief Medical Advisor from the Bipartisan Policy Center, as well as GTMRX President, Dr. Paul Grundy. In addition, on our recent podcast, I had the pleasure of speaking with Dr. Ursula Knowlton, the founder and Chief Operating Officer of Tabula Rasa Healthcare, a new GTMRX executive member. The topics of the podcast include a range of areas of interest and aspects around team-based care, optimizing medication use, the role of primary care to get the medications right. So be sure to listen at Healthcare Now Radio or tune in through whatever platform you listen to your podcast. As you probably know, earlier this year, the GTMRX Institute hosted its first public event with the Bipartisan Policy Center called Get the Medications Right, Innovations in Team-Based Care. After the public meeting, more than 50 national thought leaders convened for a 6-hour executive roundtable discussion moderated by Susan Denzer, Senior Policy Fellow for the Robert Margolis Center for Health Policy at Duke University. The Institute used the Bipartisan Policy Center morning session, the executive roundtable discussions, and 6 months of work from the Institute's 4 work groups to inform our Blueprint for Change. The blueprint creates a roadmap for the Institute's work as we move forward over the next 12 to 24 months to engage physicians, clinical pharmacists, and other team members who share a complete commitment to medication optimization. We'll accomplish this by providing tools and data and practice standards and implementation resources to advance the care team's ability to optimize medication use across the healthcare continuum. Now, our work is designed to ensure that all Americans have access to this personalized, person-centered, systematic, and coordinated approach to medication use, because we believe that will vastly improve outcomes and reduce overall healthcare cost. But our ability to optimize medication use is within our reach if we align systems of care to integrate comprehensive medication management. And in order to do that, we've got to engage patients to ensure that they are willing and able to take those medications that are indicated, effective, and safe. This is in partnership with patients. But we also must find a way to pay for these services. We know that appropriate diagnosis, bringing clinical information to the point of care through health information technology, and access to advanced and complementary diagnostics are essential ingredients to target correct therapies. So with the release of our Blueprint for Change, we are excited to offer a 12 to 24 month roadmap that outlines the work of the Institute as we move forward. So look for an announcement soon regarding the Blueprint for Change. Now, I mentioned to you before that in January we convened a group of employer coalitions. Those employer groups and those employer purchasers or health plan sponsors that are working on the front line of value-based purchasing across the United States. We convened this group of coalition executives who are members of the Get the Medications Right Institute. And the byproducts of our work will be to educate, inform, and raise level of awareness of the employer side of healthcare around comprehensive medication management. We intend to release an employer toolkit in 2020, and it will be informed by organizations, including these 8 leading employer healthcare coalitions, who have been offering invaluable guidance for use not only in educating employers about the waste in the healthcare systems, but also around quality issues and losses attributed to non-optimized medication use. While we brought this group together in January and had planned to bring them back together in April and May of this year, Our work has been a bit delayed due to COVID-19. We will continue to work with them and sit down to discuss how they can act together to be a driving force in change, moving us from a trial and error system of medication use to one that is team-based, precise, cost-effective, and most importantly, patient-centric. We know at the Institute that employers, as major purchasers of medical and prescription drug services, can have an enormous impact in making sure we and our loved ones receive the right medication and the right dose at the right time through the programs that they pay for and sponsor through their health plans, PBMs, and establish directly with vendors. We believe that this toolkit will be a powerful tool for advancing and building demand for CMM services as these employers work as health plan sponsors to find innovative solutions. So be sure to keep an eye out for updates on this important work. And if you're interested in sponsoring any of our learning opportunities and employer sessions, please contact Sandra Morris, the Director of Business Development for the Get the Medications Right Institute. Now, also an important communications tool with our members and partners and the rest of the healthcare community are our bi-weekly blogs on operations and important updates about our work. I want to point out two most recent blogs that can be found on our website. In thinking about the new normal, I question just what is this new normal that everyone is talking about? Is it something temporary that will gradually disappear once we subdue COVID-19? Or is it something more lasting, a true new normal, not a temporary normal? I believe the answer is yes to both questions. Yes, it's temporary. Eventually, we will be back to our regular spaces and schedules. But that's just part of it. I also believe that for better or worse, and mostly better, we have indeed entered a permanent new normal, especially when it comes to the use of technology. From remote clinical trials to telemedicine visits to AI triage, we're seeing technology use expand more quickly than we might have expected. Now, because of the necessity of social distancing and loosening of regulations, telemedicine is becoming the default method of contact for non-urgency encounters. What will the pathway back to traditional face-to-face visits look like? Will we find new ways to expand telemedicine, bringing care teams together with the patient virtually? And if payers begin to reimburse appropriately for remote encounters, will team-based care be transformed for team members not traditionally found under one roof as a way to control cost, improve access, and alleviate stress for patients and providers? Now, perhaps the most promising potential for new normal is point-of-care diagnostics and risk stratification. Artificial intelligence has become one of the first lines of defense, and hospitals are using it to help screen and triage patients and to identify those most likely to develop severe symptoms. I have another blog post that explores these possibilities with risk and surveillance and tracking. In the blog, Make COVID-19 All Hands on Deck More Than a Rallying Cry, we look at how all hands on deck have been the call to action over the course of this pandemic. And healthcare workers are indeed putting themselves on deck. But there's a problem. It's certainly not our brave healthcare workers. It's the healthcare delivery system. It's broken and wounded. COVID-19 has revealed to everyone what those of us working in healthcare transformation have long known. The structures we have in place to deliver and pay for care are crumbling. Our siloed delivery system, built on a fee-for-service chassis, does not respond well to demands that call for all-hands approach to patient care at the population health level. The pandemic-related scarcity of health workers points to an opportunity, and clinical pharmacists should be called upon to perform what they are trained to do. As we move past this pandemic, We should continue to ask how we can effectively align and reward these teams on an ongoing basis to support quicker access to diagnostics and a more rational approach to medication use. And in what way our payment policies should be redesigned to support team-based, person-centered care. We do need all hands on deck today and after the pandemic subsides, but we must remove payment and policy barriers that prevent key healthcare professionals from actually reaching the deck. Be sure to look out for our upcoming blogs for this month and on our website. And also, subscribe to our mailing list if you've not done so already. I've got some good news to share with you. Even in the midst of the pandemic, the Institute continues to grow. As we continue our outreach and provide various educational and informative outputs, the Institute's membership and reach continues to expand. As of this week, May 26th, the Institute has nearly 900 individual signing members, representing over 625 companies across the country. We are so proud of this accomplishment, considering that this well surpasses our 6-year membership goal. So thank you to everyone who has become a signing member and has signed on in agreement with our belief statements. And with that, I want to thank you for listening to this update. Our sincere gratitude goes out to all of our members, especially those of you who are on the front lines demonstrating bravery and commitment in the face of this challenging time. If you have any questions or would like to get involved in our work, either through a work group, webinar activities, podcast, or sharing resources, please contact us. We'd love to hear from you. We'd love to have more hands on deck, offering their unique perspectives to support our work. So until next time, be well.